I'm Dr. Sanjay Trivedi. I am from Ahmedabad, Gujarat, India. We operate variety of cases of knee, shoulder, and other joint-related arthroscopy and sports injury cases, and do bit of reconstructive joint surgery as well. Unfortunately, personally, I didn't use any of the synthetics. My knowledge about synthetic is as good as in textbooks and research papers, and I was quite discouraged by those reports, and I was pleasantly surprised when I come across the Xiros Jewel device, and when I got a little closer to the device, I realized that this is a fantastic addition to our armamentarium in dealing with complex cases. That has filled a gap which I felt while doing a lot of complex cases which we were thrown from the peripheral referral centers, like complex revisions, complex multi-ligament injuries. That is where the synthetic ligaments have helped us in giving good outcomes to our patients. So basically, we use it for intra-articular ligament reconstruction in especially challenging cases like obese hyperlex females, obese males with very high BMI, more than 35-40, revision ACL reconstructions, primary PCL reconstruction, and multiple cases where there are limited choices for the graft. So there are many patients, especially females and middle-aged males, who would like to get back to their normal life faster without sacrificing their own biological tissue and then prolong rehab. That is where the synthetic, which is off the shelf, helps them and surgeon both to finish off the procedure faster, and rehabilitation is much quicker after that, and recovery is faster after that. That is where I think patient point of view it helps them. Extremely satisfactory. Patients immediately tell you that they had minimal or no pain post-operatively, and they are quite happy about that. And they tell that they got back to their activity of daily life pretty fast, and their profession, business did not suffer long as they expected when they visited other surgeon who offered them biological grafts and explained to them that you will need a little longer period of rehabilitation. Amount of exercising or self-administered therapy, physiotherapy exercises are also required less sessions and time. I think for the medial side of the knee, there are many cases where ACL is associated with the medial collateral ligament insufficiency, and hamstring graft is often not required to be sacrificed because there is a medial injury as well as ACL. That is where they should start using this JewelACL graft. Another indication I would say is the MPFL reconstruction, where this thin gracilis graft can stretch over a time and actually make your result inferior as the time progresses. So these two things they should try, but I would advise them to take a plunge straight away into intra-articular ACL reconstruction, because that is the most familiar kind of surgery most of the arthroscopy surgeons do, and they will immediately get a hang of it actually.